Day 2 na po tayo. Ay, day 1 pa pala. Sorry po.
Okay po.
Yes po. There are many ways to choose points for treatment. One could give needles in the points where pain or other symptoms manifest. These are called local points. One could consider the meridian that passes through the affected area and treat that meridian on points that are away from the affected area. These are called meridian distal points. One could consider the area where the symptom manifests, like in the head, thorax, and abdomen, and use points that are empirically known to influence these areas. These are called general distal points. The symptoms affecting the patient, such as headaches, sleeplessness, diarrhea, constipation, cough, and asthma, pruritus, could be treated with empirical points called symptomatic points. The tissue that is affected, like muscle and tendon, bone, skin, organs, perhaps in many areas of the body, can be treated with special influential points for these tissues. Or, better still, you could combine all these points to give a cookbook recipe treatment. Some acupuncturists treat very few points in the session to bring about a change in the energy imbalance the patient is suffering from. These are called energy balancing points. Okay? A good acupuncture treatment is a mixture of cookbook points and energy balancing points. Most schools of acupuncture seem to concentrate on either one or the other. There is nothing wrong with cookbook or symptomatic treatment except that the results which seem to be short-lived. The patient seems to improve during the treatment period, but the symptoms return in a few weeks or months. The energy balancing treatments, however, are highly successful, but this must be given correctly. And for this reason, one should be able to make an exact diagnosis of the energy situation. These treatments also require deeper knowledge of traditional Chinese medicine and greater clinical experience. Both these take time and are more difficult to achieve, and one cannot ask patients to wait until such a time as one is highly experienced. The compromise is the compromise is to combine the best of both worlds, and both help the patient and learn as you go along. The simple rules of point combination are local points, distal points, symptomatic points, influential points, and energy balancing points. These points are combined together in a session, and the patient gets about 8 to 12 needles in all. There is no need to follow rules to the letter. You do not have to use points of each category in one treatment. Use them as you feel necessary. Okay? Now let's talk about local and adjacent points. Patients come to us with one or many problems for treatment. Most of their symptoms manifest in a particular area. So it makes sense to listen to the body and treat the area of the body that manifests the problem. The points that the problem manifests are called the local points. These need not be acupuncture points, but if there is an acupuncture point in the affected area, this could be used. Sometimes the affected area cannot be needled. For example, the eyes or a cyst in an inflamed or open wound in a hematoma. Sometimes the affected area could be quite extensive. In this case, we could use 2 to 3 local and adjacent points in one treatment, and even more needles if the affected area is large. If there are many local points, example, multiple joint pains, or if the affected area is extensive, like neurodermatitis, then local points are not used. The affected organ system is treated energetically, like joints, kidney and liver, skin, lungs. Remember, small disease area is the local points, large affected area, only general points. Some local acupuncture points would be very strong energy balancing points, and they may be unsuitable to certain circumstances of energy imbalance.